Hi everyone, my name is Cathy Sebag and I am the CEO of Cervlnsight. And today I'm here to tell you about cervical cancer. Cervical cancer is the cause of death for more than 350,000 women every single year. It's the only cancer in the world where mortality is actually rising. And in 39 countries, it's the leading cause of cancer death for women. Not one of the leading causes, the leading cause. And now what most people don't know about cervical cancer is that it's caused by a sexually transmitted infection called the human papillomavirus. Most people will be exposed to HPV at some point in their lives, it's a reality. But for some women over 7 to 10 years, the infection causes cancerous lesions. Now the good news is that there's a gold standard test. Here in Israel and in the global north, we have pap smears. They were invented in 1943. My grandma had a pap. All the women in this room know that it's horrible, that little stick, that cold yuck. The user experience is actually horrible. Tech has made the test faster to process, but the user experience is still horrible. But you get a smear, it's caught early, you don't die. Okay, great. The problem is that in most places in the world, women don't have access to labs. In Africa and Southeast Asia and Latin America, and even, by the way, in the rural United States, there are not labs, there are not cytotechnicians, and supply chain systems break down. These tests only reach 31% of women globally. And the saddest part is if you catch that cancer in the first 10 years, you can treat it in under 5 minutes in a primary care office. You spray lesions and they fall off. And so it's really quite a tragedy. And so instead of figuring out how do we make tests and labs faster and better, we said, how do we start from scratch? How do we empower nurses at the primary care clinic to actually test for cervical cancer in an effective way with the devices and the technology that they have available to them? So we developed Cervlnsight. Cervlnsight deploys AI-powered cervical cancer screening directly from a mobile phone. It sounds easy. It's meant to be easy for the user experience. There's a data-secure application. Most clinics in the developing world today have phones for other digital health programs, and we run directly on those phones. Doesn't matter if it's a $700 iPhone or $175 Android. We take control of the camera. We run 14 different AI components at the same time to guide the nurse how to get an expert-level image. In one of our studies, we found that the images captured on our phone actually exceeds the image quality of those captured by gynecologists on a $15,000 colposcope. It's not because the AI is amazing, it's because it's actually just easier to use a phone than a medical device to get a picture of cervix. We then take that single image and we give a result the same level as a pap smear and under 2 minutes in the same visit. I don't know if anyone in this room has ever had a pap that's come back with inconclusive results. You're waiting for 6 weeks. It's agonizing, similar to the biopsy that Nayara just spoke about. It's agonizing. You walk out the same day with a result and you know if you need to be treated or not. Now it sounds simple, so why hasn't someone done this before? The reason is it's hard. We have to train the AI, not so that it guesses if it's cancer. There's a lot of, I'm going to use some graphic language. The vagina is a yucky place. There's a lot of things going on in the cervix. There can be bacterial vaginosis, yeast infection, mucus, blood, and we need to be sure that what we're detecting in our AI is actually cancer. And so instead of building in pristine conditions where it's easy, and I wish we could, we build in the hardest places in the world to build technology in Eastern Congo, in Northern Nigeria, and rural Ethiopia, where the rates of disease in the world are highest, and where we also have what we call yucky cervixes. Women walking around with gynecological conditions unresolved for years, so that when we train our AI, it knows that this is a yeast infection and this is a white dot from cancer, and we're not mixing the two, and we can give women accurate treatment without any experts, any colposcopes, any labs right there. It's hard work, right? I don't know if anyone ever coordinated a biopsy in Eastern Congo. It's not easy. But when you figure out systems, you actually can find that you can build transformative technology. Today, this is not just an idea. We've been extremely lucky to build this technology completely with non-dilutive capital, with a $2.3 million grant from the US National Cancer Institute for cancer moonshots. And with that money, we've collected the largest database of cervical images with co-tests, HPV tests, pap smears, and biopsies, not just images in the world. And our accuracy sits higher than a liquid-based pap smear, precisely because of where we train our AI, precisely because we've been working in the hardest places in the world. And today we found almost 1,500 cases of cancer where women have walked in with the disease, were treated on site, and left cancer-free. Now, the world that I believe in is where every woman everywhere, whether that's in Lagos, in Kinshasa, in rural Texas, in New York City, can go to her primary care provider and get a cervical cancer screening and know that moment if she's cancer-free or not, and get treated there, right in that moment, if she has pre-cancer, so it doesn't advance. And those statistics that we saw there don't have to be reality. If you guys walk out of this room remembering one thing from this talk, first of all, if you're a woman and you live in the global north, go get your pap smear HPV test. It's very important. If you have a partner, tell them. The second is when you read a jarring statistic that labs don't work in the developing world, or cervical cancer is on the rise again, even though we know how to prevent it, I want you to think to yourself, that didn't have to happen. Because we have the tools to put phones in the hands of nurses anywhere at less than $1. Thank you, everyone, and good luck to the other finalists.